Welcome to Minority Focus. I'm your host, Jimmie Moore. Thank you very much for watching the show. We've got a lot of people who do a lot of things out there that are evil, mean, cruel, and there doesn't seem to be yet any kind of study done on how to prevent or stop those people from those kinds of feelings. As any part of the body gets sick, the mind gets sick. And fortunately, in some of those illnesses, there are places and people you can go who have means of treating those things that you go through. One of those being bipolar disorder, seldom discussed, it seems. And here to talk about that with us today from the Four Rivers Behavioral Health is Jennifer Gregg, who is the program manager for the Adult Crisis Stabilization Unit.
That's right.
I knew I wasn't going to get it.
Well, it's a mouthful. It is.
I did pretty good, though, huh?
Yes, you did.
Yeah, good. Thank you very much for coming. I appreciate it.
No problem.
This is, I think, a wonderful, well, not necessarily wonderful, but a very interesting thing that people don't talk about very often, the bipolar disorder.
That's right.
As far as you know, what is it?
Bipolar disorder is a mood disorder as categorized in the book that clinicians use to diagnose, called the Diagnostic Statistic Manual. And it's categorized as a mood disorder because it does impact pervasively, mainly the way that we feel. And it also attacks the way that we think and that we behave as well. It used to be called manic depression back in the old days, but now they've kind of changed the term to bipolar disorder. And there's several different types, but a good synopsis of it is basically that it changes back and forth between periods of depression and periods of mania, which can look different in a lot of people, which is why it's so hard to diagnose.
Right. Well, I heard you saying the back and forth kind of thing. Are there cases where one or the other is the main? Does a person become? I don't know how to talk about it. When I say bipolar, I want to give those. I think it's easier to say manic-depressive because manic means fast or high,
That's
and
correct.
of course you understand depression. But is manic ever the predominant part of it?
I think that when people think of bipolar disorder or manic depression, they think about the manic part the most because it is the most intrusive into people's lives. It's the part that gets the most attention, that looks the most different from normal behavior. And so that's what people see more, when in actuality, the depression side is the side that sometimes is exhibited more often.
Right.
It's just not as noticeable.
A person that's manic, I've understood it as if you're happy, fine, but if you're exceptionally, noticeably happy, problem, or possible problem.
Yes. If it has no merit for it, if there's no reason for you to be so elated, I mean, if you were leaving on a trip to Disney World, of course you're going to be excited about that. But if it persists over a period of days and sometimes even weeks, along with some other issues, then you may be looking at mania, being very, very sped up, not being able to make decisions as calmly and rationally as maybe you would at other times. Just making reckless decisions such as substance abuse or binge eating or overspending. Those are all things that together kind of point towards mania.
Right, and of course the depression part of it can be hidden easily. It's just a matter of staying at home, so it's not as noticeable.
Right.
But can be just as devastating.
Oh, definitely. You're seeing people that get too much sleep, not enough sleep, just have those chronic feelings of sadness and emptiness, and it's very difficult.
Right. In the area of the mania, the manic stage of it, is there a fine line between being exuberant and being manic? And I would think that only people who know an individual would quickly notice that there may be a problem there.
Yes, potentially, because just being happy, exuberantly happy, isn't the whole picture of it. That might be one of the more noticeable sides of it, but it's all the other symptoms of mania that combined would be able to fit under that diagnostic criteria.
Right. You mentioned people spending money and all that sort of thing. Now, I would think that the average person, when they get a lot of money, they're happy. Or when you can spending is a good thing. It's fun. You know,
Right.
women and their shopping things, and men and their
right.
toys,
Retail
and
therapy.
all that sort of thing. But in trying to understand, instead of buying a motorcycle, which I can afford, trying to buy a yacht, which I can't.
Right, and a lot of people go into deep debt in these periods of mania because they spend without being rational about their thinking. Everybody wants to buy things, and sometimes, you know, you may buy a pair of shoes, like you said, that may be a little more expensive than what you should have bought. But these periods usually lead to great spending or lots of gambling, where people will go far into debt at times.
Right. I've noticed, I've read that there are a number of movie stars, actors, whatever, who have the bipolar disorder. The comedian Robin Williams. If that's not manic, I don't know what manic is. You know, but it
like
seems
it.
to be a controlled kind of thing. If it's going in a particular area and it stays in that area without delving off into other too far out stuff.
And that's a good thing. Once those puzzle pieces come together and you're able to look and see what your symptoms are of bipolar disorder, you're going to be able to control them a little bit more when you are putting together how you're personally dealing with it, and possibly even medication or therapy. It may be something that is a little more controllable, where you can just kind of control it into one spot. But without together working on that with multiple areas, it's going to be difficult to control.
Kids, adults, evenly, does it happen in children and adults?
Well, that's a period of a lot of debate, or a subject of a lot of debate right now, actually, because they say that bipolar disorder usually starts between the ages of about 15 to 25 years old. But we're seeing children younger and younger being diagnosed with bipolar disorder. And a lot of times it seems, just from my own experience, that at times that is being overdiagnosed by some doctors and things like that, where they see examples of the mania where it's more just children being children, or maybe it's a mood control issue or something like that, where it might not be the full meeting the criteria for bipolar disorder. So I think they're going to revisit that the next time that they come out with the new diagnostic criteria, to be able to fine-tune that a little bit.
Right, right. I had an aunt that passed some time ago, and in her latter life, 70s, 80s, and like that, she would do some pretty different things than what we ordinarily saw her do. But she told me one day that she was having the best time being crazy or acting crazy. So again, it's a matter of knowing the individual and when they step outside of what you see as their norm, doesn't necessarily mean mania or whatever. Right. That's. I think I want to put it like this. In the depressive, from what I've understood about it, the line that people, the norm, and that people who are bipolar either do the extreme one way or the other. Are there situations where mania is kicked in by something, or depression is, of course, depression kicked in by something that goes to the extremes like that?
That's true, because even people with bipolar disorder will have those times of being normal and feeling like everything is under control. And then there's things that will kick those things into play, like decreased sleep or additional stress, or things that will change that life situation. Divorces, grief, loss, anything like that, that just causes that additional stress will kind of kick either one of those things into gear. And what makes it even more confusing is sometimes the mania and the depression happen at the same time, which is called a mixed episode, and that just makes it even more confusing for people to understand.
Wow, the mixed
mixed episode.
Well, actually, both things are happening. That's got to be one heck of a bounce. Like,
Yes.
From minute to minute, a change.
They can be sitting there depressed but with a smile on their face, or wearing, flashy clothing but not being able to get out of bed. It's an interesting thing that's not terribly common, but there's several different types of bipolar disorder, and having mixed episodes certainly fits in with bipolar disorder.
I see.
Yes.
What does Four Rivers do with people? For people, the management. You're the manager of the Adult Crisis. What do you have to offer? What do you offer outside of medication? Well, you don't do medication, though.
Well, I don't do medication personally. I don't prescribe it, but we do not necessarily push it, but notice that it is sometimes an important piece of the puzzle for people who aren't able to manage it with just counseling alone. Because sometimes these swings can turn into very dangerous behaviors that need to be managed in a hospital setting. And at that point in a hospital setting, they're probably going to really encourage medication as well. But back to Four Rivers, what we do is we'll bring a person in, anybody who for any reason wants to come in and get counseling. It doesn't have to be for bipolar disorder. It can be for any sort of life stress, to be able to come in and get an assessment. And that just means that they'll sit down with a counselor and just talk about what's going on, talk about life history issues and family history issues, so that the counselor will be able to get a good picture of what this person has been going throughout their life. And then at that point, they will talk to the counselor about how to identify the things that cause the biggest issues and how to make changes in those areas.
Right, okay. Well, just as there's treatment for when there's treatment for, say, alcoholism, there's usually a part that goes along with that treatment for the people who have to deal with the alcoholic. Are there programs set up for those kinds of people so that they understand the bipolar person and
Yes.
know what to...
NAMI actually works closely with Four Rivers. NAMI is the National Alliance for Mental Illness, and they work closely, and they provide a lot of support for people's families and friends that are struggling with those issues.
Okay. I've understood that sometimes a person in, say, a manic episode, that there are levels of it.
That's true.
Totally acceptable levels in society, if you will, except in what people who are close to them see. They know that it's out of the norm for them.
Right.
But it's okay in society. Society doesn't see it as manic. It's just a certain creativity and like that. And then there's that stage that
it sounds like what you're describing is bipolar type 1 and bipolar type 2. When you're looking at bipolar type 2, there are going to be periods of what's called hypomania and it's kind of diet mania per se, where maybe the symptoms aren't quite as severe as you would in full-blown mania, but it would still be considered manic behavior. It's just a little bit less severe and a little more easier, or I should say somewhat easier to manage at times, but maybe not as noticeable.
I see. Some of the people that I mentioned earlier, the actors and the comedians and whatever that were supposedly Patty Duke, the old Jonathan Winters from years ago, and all of that. Can people be taught, or can they be trained or learn how to channel some of those feelings that go on inside them into positive things?
I think that they can definitely be manageable. It just means getting control of your thoughts, because if you think about it, how you feel on a day-to-day basis is largely influenced by how you're thinking about something. If you are negatively thinking about something, oh, this is the worst thing ever, it's terrible, it's horrible, of course you're going to feel more depressed. And if you feel depressed, then you're going to act in a depressed manner, and it's going to cause a negative impact on your life. So if you are so depressed that you're not able to get out of bed and you're not able to do your normal routine, you're going to start getting reprimanded by your boss, and then that's going to cause stress, and it's going to just complete that cycle. So you have to learn how important it is to think differently and have a different perspective on what's going on, because the mind is incredible in its power to be able to think through certain things and to change the direction of what might be a really negative situation.
You mentioned children earlier. A child who may be, there's this, these initials for kids that are hyper, something D, MSD, ACD.
There's a lot of those, aren't there?
They have medicines for. There can be a child that's any of those things and take medications for those things who is in truth bipolar. And at some time in their life, maybe in adulthood, it develop into what is actually. Does that
Yes,
happen?
it does. It's just very hard to pick those little pieces apart and try to figure out what symptom goes with what diagnosis, because sometimes they mimic each other and sometimes they pair up and go alongside each other. So it's really hard to be able to differentiate those when you're a child or when you're treating a child. You just kind of have to treat the symptoms as a whole, even if you can't put a perfect name to it.
Right. I've understood that that people who are particularly in the manic mania phase of being bipolar often have difficulty accepting it because it feels good. When you're happy and et cetera, et cetera, et cetera, it feels really good. So it's hard to get a person who's in that phase of it to realize it and make changes.
That's true.
How difficult is that, particularly if it feels so good?
It is very difficult. I think the only thing that can get through to some is when it's happened before and you can have them look back and see all those negative things that came out of it the previous time that had happened, because it feels so good at that moment, but it sometimes leaves a wake of destruction behind the person. So when that person doesn't want to be rational, then sometimes other people have to make the decision for them and help them get treatment, even when they don't love the idea of it in that moment.
And likewise, like a person who's alcoholic, if you will, that goes through all those terrible things that people do with drinking and can't accept the fact that there's a problem until they look back to see, as you mentioned, some of the destruction that goes on.
Right.
I would think that the really hairy part of this, the diagnosis and the treatment, is if a person goes through that and doesn't have those awful things go on.
That's true.
And then...
That's true. And part of the diagnosis part of the disorder is that these things that are happening make a really negative impact on that person's life. It's called being clinically significant. That means that something has happened to negatively influence that person's life and has caused a problem for them. Because sometimes people will have just, you know, a symptom or two and don't get to carry the full diagnosis because it's not each diagnosis has certain amounts or certain criteria that they have to meet. And if you're not meeting all those criteria and it's not making a huge impact in your life in a negative way, then it might mean that that diagnosis at that point anyway is not the most fitting.
I see. I remember reading once something about salt, a kind of salt or something that's absent in the brain that causes all of that sort of thing. Is that?
They don't know for 100% sure yet what it is, and unfortunately there's no medical test that they can run to see if a person has depression or manic episodes or bipolar disorder. The only thing you can do is take life history and look at the criteria and look at how those things are impacting the person's life and look at those symptoms. But it very definitely is something that's happening in the brain, and it very possibly might be as simple as a chemical imbalance that someday we'll figure out how to balance out a little bit better. But figuring out how to balance that out when you're talking about medications to correct those imbalances is difficult because different medicines work differently for everybody. And it's hard to be able to find the ones that'll work for you. And sometimes people get frustrated and don't want to try anymore because sometimes those side effects are worse than the effects of the disorder.
Right. I mentioned at the onset that as different parts of the body get sick, then so does the brain.
Right.
But there's a healing process that goes on in the body.
Yes.
if there's a diagnosis of bipolar disorder, is there a healing that the body can do in that area? I mean, I'm saying, I think there's a person bounce into bipolar disorder and that's it forever.
Well,
Can
on its own, that would not be a common thing, but periods of the mania and the depression can sometimes be lengthened out to a great degree. Sometimes it's only a couple times a year or once a year, even just in the diagnosis, that you're going to see somebody going through these cycles. And so a lot of times when you're seeing it in the media, you're seeing people just back and forth all the time and in this period of great distress constantly, when in reality it may not be quite so often and it might not be quite as noticeable, because bipolar disorder is definitely not a death sentence, that's for sure. People go on to live extremely productive lives where they can function in all areas.
I would think that would make difficulty in diagnosing. You know, like you said, if it's something that happens today, and then you don't see signs of this anymore for 3, 4, 5 years.
Well, usually it happens within a year. You'll usually see some of those fluctuations within a year, but sometimes it's just not so significant on a day-to-day basis.
Does it always bounce? I mean, is there, does a person fall into the depressive part of it, and that's all there is for the bipolar? Does there have to be a bounce? Is depression just depression, and being manic just being manic?
Well, no. You can have a manic episode, and that can be a separate diagnosis of just that somebody's had a manic episode. But usually when you see those manic episodes happening, you're seeing the reverse of those depressive symptoms happening somewhere in that person's life.
Right. I've noticed that in a lot of cases when there are legal things that go on, like people being in trouble, murders, killings, and whatever, robberies, whatever. And one of the reasons they give for I was bipolar. You know, the attorney comes back with this person's died with bipolar, and this is the result of their doing things. That could be real sometimes.
It can be real
other than
sometimes.
just a.
And that's why in our area especially we have a great process. It's the decriminalization process, where if an officer feels like somebody they're arresting has some sort of mental illness, that they can bring that person in for an evaluation before they are taken to the jail if it's not something that's significantly violent at that moment. And we can do an evaluation and see if we need to help that person get mental health treatment in a hospital before any other problems come to them. And that's great that lots of our local area officers have been working with CIT, which is a training process to help officers notice mental health issues that are more mental health and not just against the law.
That makes me wonder sometimes if it could be a matter of, as far as in the manic stage, could that be a case of the blind? Vegas, knowing what the I'm just thinking that was a shot at police officers. I shouldn't do that. But I know it's a very difficult thing to, unless you're aware of it, unless you know about it, have been told about it, have seen it.
And that's why this is great, for you to get people aware that it's out there and aware that it's happening, and help people link up if they're thinking that they're having any of those symptoms, to just find out a little bit more about it, because it's the education process and the understanding your symptoms that's half the battle right there.
Right. So if your son locks himself away in his room, and he does that for a week, 2 weeks, that's just his whatever, his norm. And then one day at the end of a couple of weeks, he comes out of his room and he's exuberantly happy for a long period of time. That may be a sign. It may be a sign,
and that's, you know, if there's any question as to something like that, I would definitely recommend bringing them in for an assessment.
Right, and that's the whole point in particularly when it comes to parents. You know, notice your children. Pay attention to your children.
Definitely.
Sometimes I lost a boyfriend, or we lost the championship game in football. Doesn't equate to locking yourself away for months. The manic depressive or the bipolar person will probably, this is a question, carry whatever the expected emotional response to a circumstance is, will carry it to great extremes.
That is potentially the case. Yes, that is potentially the case. And you also want to make sure that those puzzle pieces, when you're putting them together, you're ruling out other health issues or substance abuse issues or something like that, because there's different things that can happen with the thyroid or other areas of the body that can mimic those, and substance abuse can mimic some of that. So when in doubt, it's definitely a good idea to talk to your doctor or a mental health professional about those, because it can be so confusing.
For sure. And of course, it's a known fact that no matter in the case of bipolar disorder or any other mental incapacity or whatever, alcohol and drugs, that is of absolute no benefit. Makes the situation worse.
Right.
Because I'm thinking as we speak, if there's a person that's in a manic state and they choose to consume a lot of alcohol, which is a depressant, then you make it worse because you got two things going there.
It definitely will conflict, and sometimes it'll make it worse and exacerbate it, and sometimes it'll flip you to the other side and then make that symptom worse. So it's difficult.
Right. We've only got a couple of more minutes to go yet. How common is bipolar disorder in this area? Can you?
It would be difficult to say, because I think there's so much not known about it yet, and people don't really understand what all of their symptoms are, and get those things addressed, because there is such a stigma about mental health issues, and I don't want to go and get help for this, because then everybody will think that I'm crazy. Whereas when you're looking at your symptoms and you think, maybe I need to take charge of my life, maybe I need to look at these symptoms and get them under control, would be a more healthy attitude to have, although sometimes it's not always taken. And a lot of people are afraid of having to go and afraid of taking the medicines, where really when they're looking at their life in the moment, it's difficult because they don't have all those pieces together at that moment, and it's causing a problem. So it is prevalent, definitely.
Thank you so much for coming.
Wonderful, no problem.
Maybe,
Thank you.
Maybe there'll come a time when we can get you back and
That would be
talk
fun.
some more about it.
Yes.
I think it's a very, very important subject.
I do too. Thank
It
you.
needs to be taken care of better than we take care of it. I used to jokingly say to people, it's okay to be crazy as long as you know you're crazy.
Right.
If you know you're crazy, you're okay. If you don't know you're crazy, you're in trouble. And sometimes someone needs to tell you, and you need to hear that a problem's going on that might need addressing.
Right.
Thank you so much for coming.
Thank you.
Thank you so much. For Minority Focus, I'm Jimmie Moore.